Good morning. It's Dan, Hurley, and Ryan Rehl. We're back from the top, or at least almost the top. And today we thought we'd talk a little bit about vitamin D. And we chose that because Ryan gave a talk last year on vitamin D in the airway. And we do CME for our group or whatnot. And those are posted on YouTube. And all of a sudden he noticed that he had something like 800,000 hits. And that came shortly after, the COVID thing. And vitamin D has some components that are thought to be therapeutic. Historically, that dates back a long time, really started to get popular in the TB phase. And since we're here in Arizona, and Valiant T has some offices in Tucson, some of you might not know that Tucson Medical Center actually started out as a desert sanatorium, which is a place for TB patients to come, a lot of times from the East Coast, to sit in the sun and cure their TB. So today we'll talk a little bit about why vitamin D might help the respiratory system fight off infections up to and or possibly including coronavirus. So Ryan, take it away.
Yeah, so I initially got interested in vitamin D when there were some articles hitting our literature in ENT, especially with the chronic sinusitis and nasal polyp diagnoses. We started to see that there was benefit or actually a correlation with vitamin D deficiency and worse chronic sinusitis and nasal polyposis. So I decided I better to dive into the literature at that point and learn more about it. Vitamin D is a really interesting nutrient. We think of it as a vitamin, obviously, but it's really functions more as almost like a steroid hormone in our body. And you can't get a lot of it from your diet. You have to make it through the interaction of your skin with the sun. You can supplement with over-the-counter supplements, and there are prescription strength, very high dose supplements that you can use. But most of us are going to get the vitamin D we need through sun exposure. And really, you make vitamin D primarily in the summer between the hours of 10 a.m. and 2 p.m. And that has to do with the angle that the sunlight hits the earth and where the sun is in the solar system relative to the earth. So, in the northern hemisphere, we generally get most of our vitamin D production through sun and skin interaction in the summer. And what you'll see is that patients tend to have higher vitamin D levels in the summer, and then they kind of bottom out in the wintertime when people aren't outside. And then, of course, we all know about vitamin D. We're taught, growing up in school, vitamin D is important for bone health, and
Rickets.
Yeah, preventing rickets. But there's a vitamin D receptor in every cell in the body, it turns out, and it's acts as a transcription factor to create proteins, turn on genes. So vitamin D is actually doing a lot, and it turns out it's really helpful in our immune system, and especially the immune system of our respiratory tract.
So a couple of points, because we just said that vitamin D is more like a steroid, and some people have negative connotations for steroids. Just a reminder, steroids do have side effects when we take them from outside our body as medications. Obviously, they're sometimes needed. A lot of times asthmatics use steroids. But you have to remember that we also make steroids. So our adrenal glands make steroids. They're crucial. If we didn't have them, we would not function. And so when we're talking about vitamin D as more of a steroid than a vitamin, it's in that realm. So Ryan, why do they think that vitamin D helps with respiratory infections and or sinus issues, which is where we kind of started with it?
Yeah. So, vitamin D, it turns out, downregulates some of the pro-inflammatory cytokines that we see when we're infected. Also, one of the most fascinating things I found in reading about vitamin D is that it turns up the production of an antimicrobial peptide called cathelicidin. And cathelicidin is this protein in our body that can combat viruses, fungi, and bacteria. And vitamin D, it turns out, upregulates that. So that's one of our kind of innate immune mechanisms that, when we're encountering some type of infectious organism, that's something that right away can, work to attack the virus or the bacteria. And but the downregulation of the pro-inflammatory cytokines and the antimicrobial peptide upregulation are just kind of a part of what vitamin D does. And there's been a lot of benchtop research. There's a lot of studies that show correlation with vitamin D deficiency and higher incidence of infections. And finally, in 2017, there was a really good article that was published in British Medical Journal, BMJ, that was a meta-analysis with about 11,000 patients, and they actually showed that vitamin D as therapy, so patients taking vitamin D actually had a lower incidence of upper respiratory infection. So that was kind of the first study that I came across that said, okay, this is interesting because this is vitamin D as therapy. Now, obviously there's a vitamin D craze with coronavirus going on right now. We don't have any studies that show that vitamin D as a therapeutic agent works against coronavirus. There are clinical trials that are enrolling patients right now, so hopefully we'll have that data, within the next couple of years. But we just don't have that. All we have right now is association data.
So that means, for example, that we've noticed, and if you do a Medline search, for example, you'll find 180 articles that associate vitamin D and coronavirus. And some of them are letters to the editor, some of them are associations, but you'd say, okay, you are more likely to be deficient in vitamin D if you are diabetic or obese, and those are also the negative factors that tend to do poorly with coronavirus. Also, there's been associations noting that the more severe coronavirus fatalities appear to be associated in the, quote, winter, where there'd be lower levels of vitamin D, so there's a theory that it could associate. Now you might say, well, you guys are in Arizona, you guys just had your spike, what about that? Well, if you're from Arizona, you know that in the summer, we hide from the sun. It's just too hot. So that would correlate. But again, as with everything, it's very important to remember that correlation doesn't imply causation. There's a lot of that goes around in the mainstream. But there are studies that should show, and I think that the concept is that the evidence implies that it may be helpful and it's unlikely to be harmful, and therefore something that's simple to do, getting outside and getting in the sun and absorbing some vitamin D is good for you. What are your thoughts on that?
Yeah, I would echo that. I think we need to be cautious about, saying that vitamin D can provide therapeutic benefit against coronavirus. It may very well do that, and I really applaud the efforts of those putting together the clinical trials. I'm really excited to see what that data tells us about vitamin D as a therapeutic agent in active coronavirus infection or as a prophylactic to prevent coronavirus infection. But we do need to be careful. All we have right now is correlation. But we do know from, again, studies like that meta-analysis in 2017, we do know that there is evidence that vitamin D supplementation can prevent viral upper respiratory infections. We hope that translates to coronavirus. And we do know that vitamin D has other benefits in other organ systems, certainly the skeletal systems, that's been well documented. As you mentioned, prevention of rickets, and you probably don't need much vitamin D to prevent rickets. So that foods in the Western civilization are supplemented with vitamin D. You're probably going to get 100 IU's from milk and a glass of orange juice and things like that, and that's probably all you need to prevent rickets. But when you look at where we're probably supposed to be with our vitamin D levels, less than 20 nanograms per ml is considered deficient. And we look at hunter-gatherer societies who live outside, and they run at about 60. And there is some thought in the medical community. It's debatable, but there's some thought that that's probably the ideal. You probably want to be running around 50 to 60 to have optimal immune health. But who knows? But what we do know, vitamin D supplementation has been around for a long time, and even the the National Society of Endocrinologists, that's not what it's called, but they do advocate taking 1,000 IUs per day. If you're a child, 2,000 IUs per day if you're an adult, just for optimal bone health, immune health. So it's pretty safe, and we'll see what the data shows in these clinical trials.
So that's it for today, and we'll get back to you in a couple of weeks. And this is once again Dan Hurley and Ryan Rehl from the top.
Thanks. See you next time.